And I'm sure you have served our government in clinical medicine for quite some time. Now, will you tell us the role of clinical officers in Kenyan healthcare?
Thank you. I've served for, currently I'm on my 35th year. I'm about to leave also to exit the system in 3 years to come. Clinical officers are the backbone in a health center, especially now in primary health care. They are the first people you encounter when you come for treatment, and they have to get it right when they take your history and do a diagnosis. After that, they will be filtering 80% of the patients pass through their hands, and 20% they will be referring to another level.
You said how many years have you been working?
35 years.
35 years. So for 35 years being a clinical officer, how is your day like being a clinical officer for 35 years and again being the chairman of the Kenya Clinical Officers Association?
I pride to be a clinician. In all this journey, I've walked all the levels. I began as a dispensary clinician, then became an in charge. All this period I've been in administrative to the current. I am the sub-county medical officer of health, what you know as the county sub-county team lead Rongai.
Thank you very much, Mr. Odeke. Now tell us, when you organized for this symposium, what was the real objective of it to take place this week and this place?
One, we wanted to recognize the tireless efforts our retired clinicians have put into the system, especially in Nakuru County. Two, the anti-doping agency Kenya, there are drugs that we prescribe unknowingly which will be affecting our athletes out there. Yet, for us, we do the treatment as per what it entails, but we didn't know the cretinide things that govern the Athletic Association, World Anti-Doping Agency, athletics in the world. So that is what our clinicians have come today to learn, so that they'll be very cautious when they'll be prescribing medicine to athletes in Kenya.
Thank you, Mr. Odeke. But tell me, practicing for 35 years is quite a long time, and I respect that. What are some of merits that you have seen as a clinical officer?
The gratitude when my patient comes to tell me, thank you, I gotten well. Some of them we cannot even remember until when they reminded you. I even remember in part of my practice, when I was doing internship in Nakuru Teaching and Referral Hospital, that time known as PGH, somebody gave me a book written by Carson entitled Gifted Hands. After watching what I was doing with the patients for a number of days as they were visiting, and they opted to gift me with that book. And that book is still in my shelf. I felt a lot of gratitude. And also when I was a young clinician, when I was doing a lot of work, they discovered that I had the affinity, I had a passion for the children. And other health workers encouraged me to go and do pediatrics at a higher level. And that is my specialty currently.
You're a pediatric? Great. So you love children?
Yeah, I love children a lot because one thing, they don't cheat. They tell you exactly whether they are crying, or when you ask them to point where they are sick, they point to the exact point. Unlike adults who might try to cheat you or camouflage their disease.
Would you advise your children to become clinical officers?
I've tried, but I've decided to go the other way around. One is an engineer. The other one is working with the corporate world.
That's great. Finally, let me ask you the final question. You served as a government civil servant all this time. What do you think the government should do to improve healthcare in Kenya?
A lot of funding needs to be put in healthcare because there's a lot of processes and a lot of infrastructure needed, and there's a lot of employment with human resource, whereby you see like establishment of a health center, you need a number of personnel. But because of inadequate funds, you find it is ill staffed. And also, currently we are moving into different technologies. You cannot use yesterday's method to practice current method, you'll be obsolete. So you must be versed with the machines that are currently introduced.
Just one more. The Minister of Health said the other day, I saw it in the media, that anybody who endorses SHA payment during working hours on a private clinic, it shall not be paid. Did you see that?
That could be misunderstood because whether you're in private or in the government, it is a 24-hour service. You may not predict when your client will come. So SHA should be open 24 hours, whether in private or government institution.
Thank you very much. What would be your final parting shot to the people who attended the symposium today?
I have loved the knowledge that we've gotten, and we wish to sharpen our knowledge and also the partnership, especially now, medical-wise, whom we are encountering for the first time. Same to Anti-Doping Agency Kenya, ADAC, whereby we are meeting them for the first time this time, and we wish to request them to partner with us in subsequent coming symposiums or CMEs.
Thank you very much, Mr. Odeke. We are grateful for you to have participated in this interview. We look forward to working with you and interviewing you, and want you to visit our studio for more discussions. Good day, blessings.